Welcome to another episode of Rehab Now with consultant physiatrist Dr. Paula Dawson, our rehabilitation medical doctor. I'm your host, Alicia Taylor. Welcome, Dr. Dawson.
Thank you, Alicia.
Hey. Today we are talking about post.
You hear that vocals, ladies and gentlemen? I love talking about Alicia Taylor music. You hear that vocals? One more time. Love it.
We're talking about post-mastectomy syndrome. Mm-hmm. I got that correct. Thank you. Remember to check out our social media pages. Yes. On Instagram, it's Rehab Institute Caribbean, Dr. Paula Dawson, Alicia Taylor Music. On Facebook, it's the Rehabilitation Institute of the Caribbean, and our website, rehabcaribbean.com. If you miss any of our episodes, you can watch it on YouTube at Rehab Caribbean.
Yes, ma'am.
So October is Breast Cancer Awareness Month.
Yes.
Today we'll be discussing, as I said before, post-mastectomy. Post-mastectomy. Yes, syndrome. Mm-hmm. Can I ask you, Doc, what is post-mastectomy syndrome?
So post-mastectomy syndrome, the question is what? Post is after.
Yeah.
Mastectomy is something. All right, so it's removing the breast, usually a surgical removal of the breast and surrounding tissues with or without the lymph nodes in the axilla, which on the armpit, when someone has breast cancer.
Okay.
All right. And so being that this is breast cancer month, breast cancer is such an important topic. Mm-hmm. Why? Because you can early detection can be treated successfully.
Yeah, it can save you.
It certainly. Mm-hmm. So do you do your monthly checks?
I do, actually. I do my monthly checks.
All right. So how do you do it? So we're talking about, ladies and gentlemen, being that it's breast cancer month, early detection, you have to do your self-breast examination every month, usually just after your menstrual period. If you have your menstrual period or if you're postmenopausal, you just choose a date and you do it at least once per month. Okay. So how do you do yours?
Yeah, I don't know if I explain it. The feel-up thing.
The feel-up thing?
Feel-up underneath it.
So we all call it palpation.
Palpation, thank you.
Your 3 middle fingers. Right?
Okay.
You make your fingers quite flat. So you either do it while looking in the mirror and you put your hand over your head. Mm-hmm. Why? What does that? It kind of spreads the breast tissue. Some people might do it lying down flat on the bed because that might be easier. So you lie on the bed and so you put your palm behind your head and you bring your elbow up. And so that kind of opens your chest. And so then you cut the breast imaginary into four sections.
Thank you for that.
In the quadrant. So if you're looking at the clock face, so the breast treat the breast as a clock.
Right.
So between 1 o'clock and 3 o'clock, that's the upper right, upper quadrant. 3 to 6 o'clock is lower right, and 6 to 9 o'clock is lower left, and 9 to 12 o'clock is upper left.
All right.
So you go through each quadrant with your fingers flat. Make sure your hand is out of the way so you can feel the tissue. Slowly you go around in a circle and you're feeling for lumps.
Okay.
Right? And then you also go up, if you can, into your axilla.
Yeah, but how do lump feel? Because I feel like there are some parts of your breast that kind of feel little lumpish.
I like that question. Lumpy bumpy.
So how do I know what is the bad lump?
So what will happen is throughout the month, based on your menstrual cycle, you'll have changes in your breast. The breast tissue will change. And so sometimes closer to your menstrual cycle, closer to your period, you'll have tender areas that are kind of lumpy and painful.
Yeah.
Right? And that's just because you get sensitivity because your hormone changes, especially in the mid-cycle as well. When you have ovulation during the middle of your menstrual cycle, when your hormone changes and you're producing an egg, you get changes in the breast as well, which is why we usually say do it just after your period when the hormone levels kind of balance out a little bit. But when in doubt, do not leave it out. You go to the doctor. I used to say, when in doubt, leave it out.
Yeah, man,
but no, in this instance, when in doubt, you do not leave it out. So you feel your breast. So if you feel a lump this month and the same lump is there next month and then next month, worse if it's getting bigger, or if it's hard, but if that lump disappears and you get another one, that's another one. Most times, not all the time, that is just breast changes with the cycle, right? But which is why it's so important for you to know your breasts. Examine your breasts regularly, so whenever there's a change,
You know.
early. And early detection can mean successful treatment for breast cancer.
And that is when you go and get your breasts checked.
That is, we go to the doctor, and the doctor will determine, yes or no, that is a lump. And then, of course, there are different things that the doctor may do. Depending on your age, you may do a mammogram. You may do a mammogram. Usually, people say, no, mammogram, because it's very painful.
Is it?
I've had it done once when I had my son and I was breastfeeding. They did it. So imagine that you're pressing a breastfeeding breast on the machine. You think about that, but it was quite painful. But I did it. But a lot of times when you have big breasts, young people's breasts or breast is dense, you can't see much in the mammogram. So they do breast ultrasound. Oh. So you kind of back up the mammogram with the breast ultrasound. But guess what they now have, which is just far superior?
Tell us.
Breast MRI.
You can do an MRI.
You can do a breast MRI. So it's a special, and Winchester has a breast MRI. So you actually have the coils that are shaped like two breasts, and you lie on your tummy, and your breasts will go down into the magnetic coil thingy-majiggy. I don't know what it is. We'll ask Dr. Curlew when he comes. And you do a breast MRI, and you do thin slices through the breast, and you look at the breast tissue. Very sensitive.
Slices.
Oh, well, you don't cut up the breast.
No, man, we have to check. We're just trying to know.
But what I mean by thin slices, it looks at the breast at every millimeter linearly, so it doesn't miss anything, right? So, like ultrasound, you kind of go around, you kind of rub in the ultrasound machine, whereas with breast MRI, it shows everything. So breast MRI, we get to diagnose already, but we were talking about prevention.
Listen, before we get there, when I think I said to somebody once that I wanted to do a mastectomy, and they said I'm too young to do that. I have to wait until I'm 50 before I can do a mastectomy.
That's interesting, because you have some families that have the cancer genes. You don't have that, but you have certain families that have the cancer genes, and you have the young people doing prophylactic bilateral mastectomy before. I'm sure you've read it in the news where if the mother has a particular type of breast cancer and they do the genetic study, the daughter will go ahead and just take out both breasts. I think there was some celebrity in recent times that did it.
I know the celebrity that did it.
I can't remember who it was.
I know.
Okay. Right. And so, then why you wanted to do a mastectomy? Anyway. So, no, you don't want, unless you think that you have breast cancer or you are...
I just thought it was something like a pap smear where you just have to do... No, I think you have to just check,
No. A mastectomy, a mastectomy is removal of the breast tissue. So, back in the day, they used to have...
It's not a mastectomy, I'm trying to say. That's
a lumpectomy.
A mammogram. Is that that's what I'm trying to...
cut off your breast?
No, man. Sorry, I'm getting it mixed up.
Understood.
I'm here talking foolishness.
Yes.
A mammogram.
A mammogram.
Right, which is...
I like that question. Okay. Yes, they were correct. You were too young to do a mammogram.
Right.
Because young people's breasts are denser. It's thicker. Young people's breasts kind of perky. And as you grow older, gravity
kind of pulls it down.
Right. And so the tissue density kind of loosens as you grow older. And so with mammogram, you kind of have to flatten out the breast on the mammogram machine and push, kind of bring down something on top of the other one. But usually for young people, we do breast ultrasound. So you have different types of breast pathology, fibrocystic disease, that you get little fibrocysts in the breast as your period changes. But yes, no, they wouldn't do a mammogram on you because a mammogram in somebody that has dense tissue. Why? Because the dense tissue can cover up what they look for calcification. They look for some little white things. So, cancer cells, when they're multiplying, they kind of, they grow a whole heap, and you tend to see like calcific areas, some little white things on the x-ray. And so when you have a young person, you look at their breasts, on a mammogram, you can't see the calcification clearly. So you'll see a lot of trabeculation, and because the tissue is young, you can have a lot of whitey.
Okay.
And so you can't see the calcification. So they do the ultrasound. And what ultrasound does, because we use ultrasound on the muscles, so it looks for homogeneous tissue. So it looks to make sure the tissue is nice and uniform.
Okay.
And where there's when it loses the uniformity, they know something's going on. But then you have the breast MRI. Like, oh, the same, you can do prostate MRI now.
I never know that.
Yes,
and
man.
that make wholly sense.
Yeah, they do prostate MRIs now. Most insurance may not pay for it because you're supposed to do the digital examination and you're supposed to do your PSA testing. But prostate MRI. And Winchester does that as well.
I tell you about technology.
Yeah, it's interesting, right?
Yeah, it is. Very interesting. Okay, great. So we have a nice little foundation.
Yeah, right.
So can we get to post-mastectomy? You have to help me with that word there, Doc.
Post-mastectomy syndrome. I want to get to post-mastectomy syndrome, but I just want to give a little plug to, what are the risk factors for breast cancer?
All right.
So you have the age, the older the person is, you have been exposed to certain drugs. So if you took chemotherapy for something else,
you can take chemo for something that is not cancer?
For another cancer.
For another
cancer.
Okay.
Right. And so you can have that. It can be, believe it or not, if someone has their first child after their 30 or so, and they don't breastfeed, that they may be at an increased risk of developing breast cancer. So having that, you need to go have kids to prevent breast cancer. But the more years you have of estrogen exposure, right. And so that's one other risk factor. People who smoke. Smoking is one of the number one contributors. And another common thing is it runs in families.
Yeah.
There's a gene, there's a breast cancer
genetic.
gene. Right. And then I think now you have high-end genetic testing that you can do to see if you have the breast cancer gene.
I have heard about that one.
And some people do it and then they just the bilateral mastectomy to prevent themselves from getting it. Right?
Can you still get it?
If you have no breast tissue, it is less likely that you can get it. Less likely. There's nothing in medicine that's categorical. It's less likely. And then, when you have developed breast cancer, you get these little lumps. And as you know, cancer cells are cells that grow. And they do not have what is called apoptosis. Let me put in a nice word, which is natural cell death. So cells will grow and cells will die. And so there's a thing called apoptosis where when the cells get to a certain age, they have to die. If not, your skin would tick up. Because you have to have dead skins go away. So different parts in your body, the cells grow, and when they get to a certain position, they stop growing. With cancer cells, they grow and grow and grow and grow, and they do not shut off. They're always in growth. So that's what happens to the breast when you get breast cancer. But the thing is, it doesn't stay in the breast; it spreads. So we'll talk.
It spreads.
It spreads. It really does spread.
All right, we're going to take a break. When we come back, we will talk about post-mastectomy syndrome. Stay with us. Welcome back to Rehab Now. If you're just joining us, we're talking about post-mastectomy syndrome. But before we get right there, I have a few questions for Doc. I want to know, because you were telling us about breast cancer and stuff. But can you see breast cancer? Is it something that you can see?
That's a very good question. And what I love about self-monitoring, your self-examination, is that if breast cancer does appear, you pick it up before you can see the symptoms.
You pick it up before you can.
You can, right? But say, for example, someone who's not monitoring themselves or a cancer that develops that grows rapidly, you can have increase in your breast size. You can have pain in your breast.
And it's one breast?
Usually one breast. But it can be more than one place in that one breast. So you can have different breast cancer nidus or points, like POCUS they call it. You can have discharge from the nipple, unusual discharge. So if you don't usually have discharge and you're not pregnant, you may start having discharge from the nipple. It might be clear, but especially if it's bloody, you want to worry about that. You can have changes in the skin of your breast. So you can start seeing dimpling. You might see one part of the breast just pulling in, dimpling. Right. Or you can have the whole skin of the breast kind of looks like an orange peel powder orange. You know how orange skin look with the tiny holes? And that's because the breast starts getting swollen and edema, and the skin kind of gets engorged, for want of a better description. And you can also get swelling under your armpits, because remember the lymphatic drainage. So the immune system, you have drainage from every tissue through the lymphatic system, and so the breast tissue will drain to the axilla, which is the armpit where the lymph nodes are, and so you may have cancer spreading to your axilla, which is why when you do the mastectomy, when the surgeons go in, some surgeons back in the day, people used to do lumpectomy, which is just take out the cancer. But people that I think, surgeons are probably doing, and we should get a surgeon to talk about it, just mastectomy, where you remove the breast. Some people call it quadrantectomy, where you remove the breast plus the muscle underneath, because the muscle might, depending on how close the cancer cells are to the chest wall, anterior chest wall, it can be close to the pectoralis muscle, which is right below, and so they may have to take some muscles with it. And then they may have to do an axillary dissection, they call it, where you have to go into the axilla and take out the lymph node. And, there are several lymph nodes in the axilla. So what they usually do is they use a dye, like they literally use a dye. When I was in New York, I did my first year in general surgery, so I've been a part of a whole heap of mastectomy. I've actually scrubbed and done a lot of mastectomy. And where I used to work was Long Island, and Long Island women were known to have a lot of breast cancer. People used to wonder why. They don't know if it's something in the water or whatever. But I used to scrub in a lot of mastectomy. So what we used to do is inject the breast with like a blue dye, and then when you dissect out the shoulder, the axilla, you look to see which one of the lymph nodes, the first one to turn blue. So that would be the first one. So usually we dissect that one out first. Maybe that one, and we call it 1, 2, 3. So we might do it in sequence. And so when you're doing the pathology, if the first lymph node that turned blue has no cancer, then it's less likely that it would spread beyond that. Sentinel node, they call it. And so they usually dissect that one out. And so mastectomy is not just taking out the cancer. It can be taking out the entire breast tissue. But we usually leave the skin and your nipples. Why? Your nipple. Why? Because it can do breast reconstruction.
Oh, really?
Yeah, man. So after breast cancer, normally sometimes they may leave a spacer in there, which is like something just to keep space. And so when the tissue heals and you're sure there's no cancer, then we can put implants in, breast implants. It's like silicone implant. Actually, we don't use silicones anymore. It's normal saline, which is salt water implants.
Oh, that's nice. So at least you still have your... okay. Because I've always wondered.
Yeah, they usually, unless the nipple tissue is involved, because it depends on where the cancer is. If it's involved, the ductules that go to the nipple, and you're not sure if the cancer... And you have different types of breast cancer. You have papillary, you have the breast tissue itself, you have different types of cancer, meaning where it's in the breast, different types of cancer itself, adenocarcinoma, and different ones. But anyway, so the point I'm making is, if the nipple is clear, you can leave the nipple, you can leave the skin. Right.
Okay.
But if the nipple is not clear, you may have to remove that, and then you can use a spacer. So what a spacer does, it kind of allows the skin to stretch, and then you can go back at some time and put in like an implant, a breast implant, so they can still look and feel their feminine, right?
Okay, excellent. All right, nice. Thank you.
Yes.
Explain to me what exactly is phantom pain.
That's another thing. So sometimes when you have breast cancer, you may have had pain in the breast before. That might be one of your presenting symptoms. And so after you remove the breast, you still have pain in your breast. So you feel pain in your breast. So phantom pain is pain in a part of the body that was removed by surgery. So most people hear about phantom pain, we talk about somebody who had like a below knee amputation or above knee amputation where you cut off your foot and you had a pain in your ankle. And then after they cut the foot off, you still have ankle pain because you feel like the ankle is still there.
Is that like a thing with the brain? Because is the pain there?
You see,
you feel the pain in it, but is the pain there?
So, right. So, which is why, as you say, pain management is such an important thing. One of the things that we did was peripheral sensitization. What does that mean? So, if you've had a pain, you remember that? If I pinch you right here, so for a year, it creates like a neuronal pathway.
Right. So even when you stop pinch me,
you still feel it, right? And so it's almost like the nerves are still kind of firing. So you usually find phantom pain where the patient had chronic pain before. People who had trauma, boop, sadly, if you get trauma and the foot is injured and you have to cut it off right away, they usually don't get phantom pain, although they can because the trauma itself was painful. But if you've been exposed to pain for a long time, like people with diabetic foot or peripheral artery disease, circulation, when you're not having good blood circulation, you get that phantom pain. So similarly in the breast, you still feel pain in the breast that you no longer had where surgery had removed it. So that's phantom pain.
How long you have phantom pain for?
It depends. Sometimes it can go on for a while, but we use similar neuropathic medications that we used for back pain, like the gabapentin and the pregabalin. Those are the medications that we use. So now the post-mastectomy syndrome that you talk about is chronic pain that continues after 3 months. So now you had a mastectomy. It's after the period of mastectomy and you're still having pain after 3 months. Whether the pain is in where the breast was or in the axilla where the dissection was.
And is that as a result of the surgery?
It can be. It may be.
Okay.
It may be a result of the surgery. It may also be a result of what we call, you tend to get something called, we have to mention lymphedema.
Yeah, okay, lymphedema.
So lymphedema. So usually when we do the dissection of the axilla where the lymph nodes are, it's along the lymphatic system. And remember, the lymphatic system is like the plumbing system that cleans the body of all the excess fluid. So if we interrupt the lymphatic system by taking out lymph nodes, we may affect the lymphatic drainage of the limb, the upper limb, the hand. And so you get swelling of the entire limb because the lymphatic channels are now interrupted. And so you get these, you get lymphedema, at physical therapy at Rehab Now Caribbean, you can have lymphatic drainage, which is a part of the treatment for pain control. So the hand can be very painful. So, the team that we put together for post-mastectomy syndrome, you need your oncologist just to make sure you have no recurrence. Yeah. The surgeon, the physiatrist, the therapist, and a psychologist, because it's very important because you've been through the diagnosis, sadly so, and now you've done the surgery and you're still having discomfort. Pain. You're still having pain. But of course we use the regular, sometimes we can actually inject. As a physiatrist, we can inject around it with different things, with corticosteroids, with lidocaine, which is a numbing medication. We can do some nerve blocks around the area. So we can try and block the nerve, right? You can block the nerve at different levels. You can probably just block it around where the breast is, or you can block it more up in the axilla area.
There's nothing that I can do to prevent the pain. That's something a doctor has to do. There's nothing what them can tell me to do at home.
Well, if the pain is from swelling, so remember, if the pain can be from swelling, you can help with the drainage. So you can help with, something called effluage.
Where is it draining?
It drains back to the heart. It drains, because Jamaica people always say rub your foot when you have swelling, rub it to the heart. It drains back into the cardiovascular system, so it adds back to your blood volume.
Okay, and that's good.
Yeah, that's a good thing.
Okay.
Interestingly, when we have patients with a lot of peripheral vascular disease and their legs are swollen, when we do lymphatic drainage, even before they're finished being treated, they have to go use the bathroom because you push the fluid back into the cardiovascular system, so they get a higher volume, so they want to pee. It's not like they're getting more water, like they're drinking water. Okay. So it's adding to the blood volume.
Okay, so how does a person know that they have post-mastectomy syndrome? How you know that that's the syndrome I'm going through? Suppose that's some other.
Boy, you're smart, my girl, because guess what? Someone who has had mastectomy surgery could very well just be having nerve pain down the arm from the neck.
Okay.
You're so absolutely correct. So a herniated disc in the neck or myofascial pain that we discussed before. So if you have neck issues, you sleep bad, or you have herniated discs in the neck and it's pinching a nerve, and remember the nerves, you have C4, C5, C5, C6, C7, different nerves on the hand. And so you may have referred pain from the neck. So of course it's all clinical diagnosis, treatment, investigation. So we may want to do investigations to look at your neck, examination. There are different kind of maneuvers we can do to determine if it's a neck problem. You have the Sperlins, different examination techniques we can use. It may be referred pain, as mentioned before, from myofascial pain. You understand? But one of the things I don't want to forget is that the breast, if breast cancer is picked up late, it could metastasize, it could spread. It can spread to the brain, it can spread to surrounding tissue, it can spread to the lungs, and sometimes you may have pain, you can have pain from the metastases and that kind of stuff. So how do you know the post-mastectomy pain is not the breast? Through clinical examination and investigations.
Finally, I probably shouldn't finally. I will leave questions there, but what can you not do after mastectomy?
Right. So you want to, because it's a surgery, your skin was cut. You don't want to do a lot of movement because you want the tissues to juxtapose and realign and start to heal again, right? And so once that settles down and you get complete tissue healing, it's just like you get a cut. After that, you can more or less do everything, but just after the surgery, you don't want to be reaching over your head. You don't want to be lifting heavy things with that hand. You just want the tissue to heal properly.
Okay. All right. Thank you, Dr. Dawson. That's all we have time for. 100 questions. I know you have a lot of questions asking.
Self-examination.
But self-examination is important every month for the women after your menstrual.
But men can get breast cancer, completely forget about that. Jeez, another time.
Definitely.
Not as common at all, but I have seen it.
That's all we have time for. Thank you for listening. Thank you, Power 106, our show producers. If you missed any of our episodes, you can watch it on YouTube at Rehab Caribbean. Thank you to the sponsors, the Rehabilitation Institute of the Caribbean, Winchester MRI, Immune Active Drink, and Almighty Studios. That's all we got time for. See you all same time, same place next week. Blessings.
Blessings.
Almighty Studios, a place to record and rehearse in first-class style, a place you will want to have your work showcased. Welcome to Almighty Studios, a place for you. At Almighty Studios, we're here to praise, to worship, and to serve, exalting the King of Kings in worship music, where vocalists, musicians, and producers are inspired. Our engineers have over 20 years of collective experience in the music industry and are skilled in the art of mixing and mastering. Contact us by calling or sending us a WhatsApp at 876-770-6282 or email us at admin@almightystudios.com. Follow us on Instagram, Almighty Studios.